You probably have a preferred side of chewing. Have you ever thought of that? Make sure that you keep caffeine away from the afternoon or the nighttime. Ideally, we should keep 30 minutes away from brushing or eating anything, or then do something that's going to elevate the pH of your mouth to avoid those detrimental effects of erosion. What we see is that we should be chewing more than 50 times each spoonful. Make sure that we're looking for things that we can chew on. Bring the pH up before you have anything rubbing on your teeth. I'm Dr. Maria Florou, and this is Mind Your Mouth. I'll be sharing with you the truth about oral health that most people completely overlook. If you're ready to go beyond the basics, challenge the myths, and truly transform your well-being, let's get started. On this episode, I'm going to be talking to the fast chewers, to the people that don't really spend time chewing on the food, and then we talk about what are we chewing on. So the first thing that I want to say, slow down and chew. Make sure you spend time chewing. What we see is that we should be chewing more than 50 times each spoonful, each piece of food that we put in our mouth, more than 50. So make sure that you spend the time. And why is that? Why do we need to chew? One, because it's the only place in the mouth where we're going to break down food in a way that our digestive tract can work on it and can take the most out of the nutrients that we're giving our body. So spend time chewing. The other thing that happens when we chew, we form more saliva, and our stomach also gets ready with the acids to receive the food. We need saliva to help start digestion. So we see that starches, anytime we eat anything starch, the enzymes are released on the saliva, and we have a lot of breaking down happening there. So we really need that saliva to help us form that mess that we're going to swallow, and then digestion can actually be quite effective, and we can improve nutritional absorption and have our body working well with that. The other thing that's really important, and most people don't think about, is how chewing actually shapes our face. What's happened that we see on research and we see on the skulls when we go to the museum, our ancestors had 4 sets of molars. What does that mean? Molars are those back teeth that help break down food at the back of our mouth. So nowadays we have some people with 3, which the third one is the wisdom tooth, but a lot of people are born only developing 2 molars. So we don't see 4 molars anymore. And why is that? Because our diet has changed. With processed foods, we eat a lot of soft foods nowadays, whereas our ancestors had to hunt and eat all raw vegetables or raw animals, whatever they found, and a lot of chewing was required. Nowadays, we don't have to chew anymore. So what I normally advise people to do is to make sure that we're looking for things that we can chew on, like celeries, apples, carrots, cucumbers, things that require chewing. And how to chew then? First, spend time chewing. Secondly, you probably have a preferred side of chewing. Have you ever thought of that? So if you do, please chew on both sides. And why is that? We do require a lot of contraction and relaxation of the muscles as we're chewing, and we don't want to overload one side of our face, one side of our joint by chewing only on one side. We see some effects of that throughout the years. Clicking jaws, painful jaws, things like that, that we can avoid simply by chewing on both sides and spending time with chewing. The other thing that we don't think about is how that shapes our face. And as the muscles contract and relax, we're actually helping the bone to grow with that contraction and relaxation of the muscles. So we shape our faces through chewing. Now, what are we chewing on? Let's talk about this one, which is very, very important. Let's talk not just about chewing, but also what we're putting in our mouth. A lot of my patients come and talk to me about lemon water, especially in the morning. There's been a big talk about how lemon water can help with digestion, help with some other functions of the body. And look, I'm not going to get into that part. I personally, it's not my professional opinion, I personally like the lemon water in the morning, but how about teeth? How does that go about teeth? What it's important to bear in mind is that the lemon, yes, it carries an acidic pH. What we want to do with that? We want to keep anything that is going to rub on our teeth away from the time of the lemon water. Even apple cider vinegar. There's been a big talk about apple cider vinegar as well. And both of them have very acidic. When we have acid, like we see things corrode. So if you put an acid on a surface, you're going to see some corrosion happening there. In our mouth, we call that erosion. So when we're talking about enamel, we see some erosion happening on the enamel of our teeth. And if we have a soft enamel that's been softened by the acids, we don't want anything rubbing on them. We don't want to chew on any crunchy foods. We don't want anything that's going to carry that soft enamel away from our teeth. Ideally, we should keep 30 minutes away from brushing or eating anything, or then do something that's going to elevate the pH of your saliva, the pH of your mouth, to avoid those detrimental effects of erosion. What does that mean? If you're someone who eats or drinks dairy, or maybe use a little bit of bicarb soda in water or some alkaline water, switch that around, bring that pH up before you have anything rubbing on your teeth. We don't want into having a healthy body by jeopardizing our teeth, but we can have a combination of things. We can have both if we know what we're doing. So make sure that you have anything alkaline every time you have anything acidic. One other thing that we've spoken about on other episodes, if you had the chance to watch them, great. If you haven't, go ahead and watch them, is the effects of xylitol. And we see that xylitol can be found in strawberries, raspberries, and some chewing gums, especially, we see them enriched with xylitol, and they do help to protect our enamel and to bring a more alkaline environment to our mouth. Real quick, your mouth is the gateway to your overall health, and at Casuarina Dental, our focus is on you. If you're ready for a holistic approach to dental care, book your appointment now via the link in the show notes. Now, back to the episode. So what foods help with salivary production and bringing that alkalinicity back up? Hydration. Let's start with hydration, not just drinking water, but having that in mind when we eat like celeries, cucumbers, that also release a lot of water in our body. And that's really important because we have a combination of both things. We're bringing some hydration to the body, but we're also having to chew more to increase our salivary production and to increase our function of muscles, facial growth, facial development, and harmony in our whole body. So what I see that the studies and the research has shown is that some medication actually affects salivary production. So if you're having to take any medication and you feel that you're having a dry mouth, go ahead, talk to your doctor, see what you can do about it. If there's another medication that can be used, sometimes there isn't, and that's fine. Just make sure you keep your hydration levels high, eat foods that require chewing, and avoid caffeine, especially after midday. Caffeine, we've seen that it contributes to the drop of salivary production. It dehydrates the body a little bit. Make sure that you keep caffeine away from the afternoon or the nighttime, especially after lunchtime, because that's when we tend to see less saliva being produced naturally. And if we put caffeine on top of that, then we're going to have more dry mouth. And as we've spoken about on other episodes, dry mouth contributes to gum disease and decay. So let's make sure that we avoid those things. Other foods that contribute to disease are things that are going to drop salivary pH, not just lemon and apple cider vinegar, as we've just mentioned, but any sugars will do the same effect. So we're going to bring acidity to our mouth if we consume sugars as well. Thank you for staying with us to the end. Thank you for watching this episode. If this is of any help to you, please make sure you follow and subscribe. Share this with your loved ones, because together we can get to better health. Thank you for tuning into Mind Your Mouth. These episodes have been created for you. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Casuarina Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.